Hey everybody, how you doing? I hope your studies are going smoothly. It's time to revise, and today we're going to be looking at psychopathology, its definitions of abnormality. Let's crack on. Here's a set of exam-style questions. Have a look at them. You've got timings, you've got number of marks. Press pause to practice. Come back, and I'll talk through them. Off you go. Okay, let's do it. Right, one definition is based on coping with daily life. The command word here is name, so you don't really need to do anything apart from just write down what this definition is. And that is failure to function adequately. Give yourself a mark for that. Number 2, outline the statistical infrequency. Okay, so no evaluation or anything yet, just a definition, maybe an example, that sort of thing. What could you say for statistical infrequency? Well, this is where we define behaviour as being abnormal based on the fact that maybe there are very few people with that behaviour. You could say that the behaviour is rare. You could say that it might be kind of like a score or something that is far away from the mean for the population. You could say that it is, maybe 2 or 3 standard deviations away from the mean, if you really wanted to stretch that up. But the key point being that it's rare. Okay. John deviates from ideal mental health. Okay, so it's a little bit of application, but not really, because you just need to know some of the criteria that Jehoda put forward for ideal mental health. So, what can you say? For 3 marks, maybe let's go for 3 things. Okay, what sort of things? Well, one of the criteria for ideal mental health is having, positive self-image or good self-esteem. So maybe that's something that John would show. So literally just write something like, John is likely to have a poor self-image or low self-esteem, yeah, because he doesn't meet that criteria. Yeah. Okay, so another criteria is something like a desire for growth or self-actualization. You might know that from the humanistic approach, yeah, Maslow. So what would John show? He would probably show, a lack of desire for growth, or he wouldn't be interested in, progressing a career or something like that. Something else. Autonomy, yeah? So a sense of control and free will. So if John deviates from that, what would he show? Maybe he would express frustration with not being in control of his life. Maybe he would have low motivation to get up and kind of take charge of things in his life. Something like that. One more for luck. What else could we say? Having an accurate sense of reality or an accurate perception of reality. So what could John show? Maybe he would express irrational beliefs about how, everybody hates him, or about how harsh or unlucky his life is compared to everyone else. Something like that. Okay, 3's fine. All right, distinguish between deviation from social norms and failure to function. So, the key point here being this is a comparison question. We want to tell the difference between the two. So social norms, remember, that's the definition that says that behaviour is abnormal based on the fact that, nobody else is doing it. So we're going against conventions. We're going against what other people think is the right thing to do. And failure to function is the one where, you're not coping with daily life that we mentioned earlier on. So to distinguish between them, you could just build in some of that knowledge to start with. You could say that deviation from social norms defines behaviour as abnormal based on what other people do. Yeah, based on what other people's attitude is. Whereas, try and use that sort of comparative language. Whereas, failure to function is based more on whether a person is actually coping with certain behaviours or tasks. And you could build on that, because this is 4 marks. You could talk more about, the fact that it's about the impacts on the person. You could say that failure to function is possibly, the more useful definition, because we're actually looking at whether someone has some kind of impairment or is struggling, whereas a person could be defined as, deviating from social norms, but still cope fine. It would have no impact on their daily life. Yeah, so we're distinguishing between them in terms of their definition, how they define abnormality, and we're distinguishing between them there on the basis of, does it actually affect their daily life in terms of the behaviour that they're showing, the impact on them, yeah? All right, that's that one. Just a brief interlude. just a little plug, if you are looking for some light-hearted, fun revision activities, I have recently launched a psychology word search book that is now available on Amazon. I'll pop a link down in the description. Yeah, you can see a couple of examples of what it looks like on the screen there. You've got lots of keywords to look for, covers all the topics from Psychology Paper 1 and Paper 2, over 50 puzzles, and you've got space to make some notes or write some definitions underneath as well. All right, that's enough of that. Links in the description. Okay, let's carry on. So we've now got an application question. So using two definitions of abnormality, we have to explain whether Wanda's behaviour is abnormal. So before we look at the scenario, just a comment on this style of question. Look at the wording. It's just explain whether her behaviour is abnormal. So you might get a scenario where actually, you know, according to one definition, the person would be abnormal, and according to another, they wouldn't. So that's okay. You know, don't let that throw you. You might just say, you know, according to this definition, Wanda is or isn't. You could even, you know, give an overall. Maybe if it was, you know, use three definitions, you could say, well, maybe she is abnormal because according to two of them. But just look out for things like that, yeah? You could say that she's normal or abnormal, depending on the behaviour. So let's have a look. So she struggles to get up for work. Possibly going to be sat. I mean, already, hopefully we're thinking, you know, she's not coping with something that everyone else does on a daily basis, which is go to work. So that's probably going to be failure to function already, isn't it? Let's carry on. She thinks this doesn't matter because she's no good at her job. Everyone hates her. Okay, so we're feeling like maybe we're struggling a bit with, you know, relationships possibly, but possibly that sense of, you know, an accurate perception of reality, self-esteem. Maybe this is deviating from ideal mental health. Wanda has no desire to look for a job or build a career. Okay, well, that's the growth, the self-actualization stuff, isn't it? So how are we going to deal with this? So let's split this into two halves. Let's take one definition, explain it, apply it, and the other one. So I'd go for, based on what we've said, I'd go for failure to function, explain what that is, make a couple of references, i.e., she's not coping with the daily task of going to work. This is impacting on her ability to, you know, engage in daily life. Second half of the response, write a sentence explaining what ideal mental health is and link in some of those criteria. So we said growth and self-actualization. Wanda doesn't show this because she's not looking for a new job or trying to build a career. She's not trying to achieve her potential. And the low self-esteem, she's not meeting the positive esteem criteria because she thinks everyone hates her, she thinks she's no good. According to both definitions, she would be classified as abnormal. Okay, don't forget to actually answer that question. All right. One limitation of deviation from ideal mental health. Okay, it is just one limitation. So for 3 marks, we're looking probably for point, explain, conclude, that kind of structure. What's bad about this definition? Let's have a think. One of the main criticisms, I would say, is that it's unrealistic. Yeah. So one limitation of deviation from ideal mental health is that it may be unrealistic. There you go. Start off with a point. What do I mean by that? Well, you know, you've got these 6 criteria that Jehoda put forward, and if we actually have a think about those, you know, think for yourself. Do you meet all of those criteria all the time? Can you say that you've got, you know, high self-esteem, a strong sense of identity? Do you strive for self-actualization? Do you cope with daily situations? Do you cope with stress really well? Are you resistant? Are you an integrated member of society? Are you autonomous with free will and self-regulating? Have you got a true perception of reality? You know, all of these things. I don't think anybody really meets that every day. You know, I don't. So am I abnormal? Is everyone abnormal? You see the problem. So in terms of explaining that, you're talking about how unrealistic it is, how, you know, most people are not actually going to meet those criteria, and the conclusion being, therefore, it's not useful because it would identify everybody as being abnormal. Okay. Right, evaluate statistical infrequency. So for 6 marks, and it does just say evaluate, so it could be strengths and or limitations, but what could you do? Maybe go down the route of it being, you know, a useful definition, because you know, you can actually, if you take something like IQ or test scores or something like that, you could identify maybe the top 2% and the bottom 2% or something like that. And that might be useful because, you know, at the top end, you could maybe target those people, you know, if you're working in a school or some kind of business setting or something like that, you could target them maybe because, you know, they've got certain talents, or you could try and stretch them a little bit and support them that way. and you could target those at the lower end of the scale for a bit of extra support and that sort of thing. So maybe it's a useful definition. However, you could actually talk about how it's actually classing some people as abnormal that we probably wouldn't want to label as abnormal. Yeah. So those people at the top end of the scale, again, if we're just talking about something like IQ or test scores, we are labeling them as abnormal when actually maybe some of that is desirable. Yeah. So even though it could be useful, it is actually labeling some desirable behaviour as abnormal, which probably isn't quite what we want to do. You could also discuss how maybe it's objective. It's just based on scores, it's based on numbers. It's not, someone sat in an office going, oh, no, well, that doesn't sound like you're coping very well, so I'm gonna say that that's abnormal, yeah? It's just based on statistics, so maybe that's a strength. However, let's take that a bit further. Who decides, what counts as rare? Is it 1%? If I'm at 2%, am I okay? Well, what about 3%? Yeah, that's subjective kind of, isn't it? And actually, it's only as good as, the measurement that you're getting these scores with. Again, let's take something like IQ. Is an IQ test actually good? Is it objective? Well, one of the criticisms of a lot of these intelligence tests is that, certainly a lot of the classic ones are things, culture bias. There are different types of intelligence. So, yes, it's based on numbers, which feels objective, but it's only as good as the data that you're getting, the measurement, I mean. And it still can be an element of subjectivity in there. So there you go. There's lots of points you could say there. You could do a whole essay with that, probably. All right. So we've got a 16 marker here referring to wonder. Now, I don't think there's any reason that this couldn't be an 8 marker focusing on one definition of abnormality. And someone mentioned this in the comments on another video recently. It could be referring to wonder, discuss failure to function, or referring to wonder, discuss deviation from social norms, or whatever it might be, yeah, for 8 marks. In which case, you probably break it down to, I don't know, maybe 3 AO1 marks, 2 AO2 marks, and 3 AO3 marks would probably be a common way of breaking that down. But let's say it was a 16 marker. We've already been through the knowledge in the application, so I'm not going to go over that. But let's just recap a couple of evaluation points for, what did we pick earlier? It was failure to function, wasn't it? And ideal mental health, that was it, wasn't it? Okay, so failure to function. What's good and bad about this? Well, I suppose a strength of failure to function is that it does actually catch behaviour that is having an impact on an individual. Yeah, so rather than just going, oh, well, not many people do this, so you're abnormal, but actually you're coping fine, which isn't great. Failure to function is actually useful as a definition because we're catching people that possibly need some support. Yeah, so we could signpost them onto other services if necessary. Despite that, just to develop that argument a bit, despite the fact that it's based on impact, the patient doesn't, or the individual doesn't necessarily realise that they're failing to function. Yeah, that is still subjective. So what if a doctor says, you're not coping with work, you're not coping with friends, it sounds like this is having a big impact on you, so this is a diagnosis or you need some support. And what if the person sits there and goes, well, no, I'm quite happy actually. I don't want to go to work. I'm not interested in going out and socialising and whatever it might be. I'm actually fine. So that creates a bit of a problem, doesn't it? Yeah. What else? I guess one of the strengths of failure to function is that there are some reliable methods used to assess it. So you've got there's two main kind of questionnaires that are used in failure to function. Not sure if you'll have come across these, whether you've studied these, but there's one called the WHODAS, which is the World Health Organization Disability Assessment Scale, I think it stands for. And then you've got the GAF, the Global Assessment of Functioning Scale. And, a professional can kind of sit with the individual and do those questionnaires with them and get some scores, which creates, some kind of evidence and some level of, what am I looking for? Maybe like consistency kind of in how that works. But I suppose then the discussion is about, it's self-report, maybe that's still subjective, and how good is that evidence really? So how good is that definition? Yeah. Right, I've waffled on about failure to function for enough now, I think. Ideal mental health, we talked about a limitation earlier. So if you skipped ahead, maybe go back to that 3 marker. I'm not going to repeat all that again. But strength of ideal mental health, what could we talk about? I guess the key strength of the deviation from ideal mental health one, is about like how positive it is. Yeah, it kind of it gives a contrast to the other three definitions, which are all quite negative and trying to identify bad behaviour, as it were. Whereas the ideal mental health one is more about saying, well, this is, in an ideal world, this is what we would want to strive for. This is what we should be aiming for. So it links into kind of like positive psychology and is a bit more kind of it gives you a target to aim for. If you are if you're not failing to function, what am I saying? If you are come on, Galbraith, sort it out. If you're deviating from ideal mental health, and you've missed off 2 or 3 of those criteria, that's a very straightforward, oh look, this is what you could be doing. In terms of something to aim for. So it's a positive definition. Okay, those were the 2 key ones that worked for wonder, so let's leave that one there. And let's just talk through some other ideas for that last 16 marker. So, discuss deviation from social norms and one other definition. Right, so discuss generally means, you're going to be evaluating, you're going to be presenting evidence, presenting strengths and limitations, all of that sort of thing. It's AO3. But for a 16 marker, that there are 6 knowledge marks and 10 evaluation, or in this case, discussion marks. So make sure that you do actually outline those definitions. Do start off with the knowledge, okay? Right, so to break it down, it says and one other. So straight away, I'm going to go, okay, well, this is 2 8 markers in a way, isn't it? So let's start with deviation from social norms. So what could we say knowledge-wise about this? Well, deviation from social norms is where we are defining a behaviour as being abnormal because because the behaviour goes against social conventions. Yeah, it goes against what a social group believe is the right way to behave. It goes against kind of the set of unwritten rules about how someone should behave. Often a behaviour that deviates from social norms will make other people feel uncomfortable. Yeah, so you could say it causes observer discomfort. Yeah, there's a few points to use there. And in terms of evaluation of it, you could talk about how there's the socially sensitive nature of saying that you deviate from social norms, and you could reference the example of things like attitudes towards homosexuality that's changed over the years, and you could talk about how the socially sensitive impact on certain social groups. Again, think of the example of homosexuality. Leads to discrimination and stereotyping, and the negative consequences of that definition, just based on well, most people do this, you're abnormal. So you could talk about that, yeah? So kind of the unethical nature of it. You could also discuss the fact that social norms differ between cultures is one issue. So you could talk about the lack of universality. You could talk about the lack of generalizability from place to place and how maybe that isn't useful. But that could even be a strength. This is the discussion, isn't it? You could turn that into a strength and say, well, actually, that's a good thing because behaviour does vary around the world. So it's good that we have a definition that recognises that in different places, in different groups, people behave differently. So, you shouldn't judge how, we might behave in, one country compared to how you might behave in a different one. Yeah. So maybe that's a good thing. Okay, another definition. We've talked a lot about the others already, really. So just make sure you're kind of treating that as another 8 marker. You're doing some knowledge of another definition, and you are presenting, at least a nice big chunky 2-sided discussion paragraph. Preferably, I would say, probably in a 16 marker, 2 points on that one, so that you've got 3 or 4 altogether in the essay. Okay. Right. I think that's enough of that. Okay, don't forget to reflect. What happened? Why did it happen? And what are you going to do next? Yeah, an important part of your study. Okay, that's it for this one, guys. I do hope that was useful. Feel free to drop me a question in the comments. Good luck, guys. Keep going. Bish bash bosh.